Hey guys, it's me again, Zoe, and welcome to Med Topics Review episode 2. So again, Med Topics Review is an audio question bank wherein I'll be asking some case-based questions, reading out loud the choices, and giving you the rationalization behind each answer. And also, I'll be adding some of my personal tips, which might be helpful for you when you're studying. I don't know, you decide. So yeah, again, I made this audio question bank for those people who are exercising or doing mindless tasks so that they can do those things while studying. I know, such a nerdy thing, but yeah, anyway, again, this series wouldn't have been possible without Boards and Beyond and Ambrose because they so generously allowed me to use their resources. So again, I'd like to give them thanks, and I hope you guys appreciate this video. All right, let's talk about the first case. So in the emergency department, a 27-year-old man arrives with a stab wound to the abdomen. After taking his vitals, he is quickly taken to the operating room for an exploratory laparotomy. A large collection of blood was visualized in the right upper abdominal cavity. In an attempt to stop the bleeding, the hepatoduodenal ligament was clamped, but blood still continued to pool into the abdomen. So, with the hepatoduodenal ligament being clamped, the question is, which of the following blood vessels is most likely causing this man's persistent bleeding? A. Common bile duct, B. Portal vein, C. Hepatic artery, or D. Inferior vena cava. The correct answer is D. Inferior vena cava. Sometimes case-based questions may seem overwhelming, but most of the time the story gives you context, and the question might in fact just be very simple. Like in this case, this man we know was stabbed in the abdomen, and bleeding was visualized in the right upper abdominal cavity. Hence, we can think of the liver. But then what was done to the patient? So after the laparotomy, a vascular clamp was placed across the hepatoduodenal ligament. Actually, this procedure is called the Pringle maneuver or portal clamping. So when this is done, this interrupts the blood flow to the liver via the portal vein and proper hepatic artery. Why, you may ask? If we recall our anatomy, the hepatoduodenal ligament contains the proper hepatic artery, portal vein, and common bile duct. So clamping this ligament will definitely interrupt blood loss. However, in this case, blood was still pooling into the abdomen. So that means most likely the inferior vena cava or the hepatic vein may be causing blood loss near the liver. So since hepatic vein wasn't in the choices, then the answer would be inferior vena cava. So now for our second case. Again, this is in the emergency department. This time, a 75-year-old man arrives and he goes like, "Hey doc, I've been having severe abdominal pain for 2 hours and it hurts. And I've been feeling so nauseous." So afterwards, you proceed to ask for his history and you found out that he has a history of hypertension, atrial fibrillation, and he has been smoking 1 pack of cigarettes daily for the past 45 years. So again, this patient undergoes emergency laparotomy and he was found to have dusky discoloration of the hepatic colonic flexure and an adjacent segment of the transverse colon. So based on what we see in his intestines, the most likely cause of his condition is occlusion of a branch of which of the following arteries? A. Celiac artery, B. Superior mesenteric artery, C. Inferior mesenteric artery, D. Internal iliac artery. The correct answer is B. Superior mesenteric artery. So based on the description of the patient's intestines, we can assume that the blood flow was disrupted, thus giving it a dusky discoloration. And approximately 50% of acute mesenteric ischemia cases are actually caused by acute arterial embolism as a result of cardiac pathologies. And as seen in this case, this patient has atrial fibrillation. So that must have caused or may have been the reason why the patient had an acute mesenteric ischemia. So now the next question is, based on the location of the discoloration, which artery was occluded? The superior mesenteric artery. If again we recall our anatomy, we know that the superior mesenteric artery supplies the small intestines, ascending colon, and the first 2/3 of the transverse colon. So in this question, wherein the hepatic colonic flexure and the adjacent segment of transverse colon, so within the 2/3, we know that, okay, then it was most likely supplied by the SMA. Now, in contrast, we know that the inferior mesenteric artery, or we may recall, this artery supplies the last third of the transverse colon, the sigmoid colon, and the upper rectum. If we were talking about which flexure will be on this side of the inferior mesenteric artery, that will be the splenic flexure. So again, my previous tip still applies to this case. If you really try your best to map out where the arteries are going and really branch them out and see which clinical correlations can you apply to these arteries, then you can truly see that it will be easier when you're taking exams. Like for here, like if you say that, okay, there was a discoloration of the hepatic flexure. So then you're like, oh, okay, then what do I remember supplies this part? And then you can either do it one way by branching it out in your head, where does the blood supply come from, or you can recall which ones did you annotate that had a special clinical significance. So yeah, I know it sounds a little bit complicated, but yeah, when you're studying, you really need to try to make as much relationships and connections as possible, because that builds a strategy in your mind and also builds like a habit of you really trying to absorb information better so that you can access that information you need in your brain when you're taking an exam. But yeah, personally, that's what works for me, and how it works for other people may be different as well. So, alright guys, we only have 2 questions for this Med Topics review episode because I really wanted to post the video right away, and I want to do it every Monday night. So again, yes, if you like this video and you like this series and you want me to keep posting, please give this video a thumbs up, and also please subscribe so that you can follow me in my journey towards becoming a doctor. So yeah, that's it. Bye!